Well, hello. I'm Robin Fuller from the First Step Family Resource Center and Ardent Solutions. And today we have Diane Davis. She is a fellow that works for the Department of Health. And today we're going to talk about lead poisoning, a topic that I think a lot of people think doesn't exist anymore.
I know. So it's great to be here, Robin. Thanks for the invite. Can I be super transparent with
Absolutely.
our folks today? So, lead poisoning is something that I'm a nurse of 40 years. And, I've just been, involved in the hospital and those kinds of things. And I decided to, come work for the public health. And they're talking about their programs. And they said, we've got this, and we've got the lead program. And I said, oh, is that still a thing?
Yep.
And I got to thinking, you and I were talking at another meeting. I'm thinking, if I don't know about it, and I'm a healthcare, provider, so to speak, I imagine people out there don't know about it either. So I'm super excited that we're here today to, talk about those kind of things.
Yeah, it's one of those things that definitely pops up when I talk to families, and they let me know that their children have different lead levels, which we'll talk about at another time, mm-hmm. But that then sparks, what is lead poisoning?
Yeah.
Talk to me about that.
Yeah. Well, I want to start by saying it is never normal to have lead in your body. So if someone said to me today, Diane, what is the normal lead level? I would say 0.
Yep.
So I think it's really super important to say that. Lead poisoning really isn't as complex as I think people think it is. There was lead paint on a lot of our walls, okay? And we live in Allegany County where we've got lots and lots of old, beautiful houses,
Mm-hmm.
that some people have inherited, from their grandparents or what have you.
Yep.
And they kind of walk into the situation, and they may not know because it's been at least carpeted, right? It might have lead paint on the floors underneath. The walls might have lead paint, but they look fairly decent,
right?
And that kind of thing. Our trouble begins when that lead paint comes and it kind of bubbles up, or it looks like an alligator skin or something like that, and it starts to flake down. Mm-hmm. That becomes, remember, lead paint, right? It's metal, right? It's a metal. So that becomes lead dust, and that's where the problem is, guys. So when that lead dust comes down, where do you think it goes? Where do you think it goes?
Everywhere,
right? It goes on our furniture, goes on our floor, goes on our toys, and it goes on our little people who are on that floor, right?
Yep.
So we want to do, tummy time on the floor. We want to have the toddlers playing and that kind of thing. And what happens is it's kind of invisible. I mean, that dust can be invisible. Some people will say, but I'm the best cleaner in the whole wide world. It doesn't make any difference, right? You know that when you go and you drop sugar on the floor and you wipe it all up and you can see it. The next morning you come down to bare feet, you step on there and you're like, okay. So still got some sugar on the floor. Same with that, right? So we just want people to know that lead dust can go everywhere. And I think this would, there's so many more ways that lead can get into our kids' bodies. But I think that we should devote some time and talk to people about what are the different ways that lead really can get into our body system. But I do want to end with this. I want to say lead poisoning is the most preventable environmental disease ever. Okay, so I'm looking forward to these conversations with you.
I am too. I can't wait. We're going to have a lot of topics. We're going to touch base on each one specifically. So look out for more.